out of mold, but a brilliant doctor, Professor Alexander Fleming, discovered that it produces the drug known as penicillin.
We have a tremendous heritage.
The plan proposes a comprehensive health service securing medical treatment of all kinds for all citizens.
As we celebrate the 60th anniversary of the NHS, I could highlight at least 2 or 3 major discoveries every decade. There are many innovations in well-being. How do we prevent patients getting ill? Innovations in diagnosis, innovations in treatment. Robotics is one good example. We're moving into what we call surgery without incisions in the future.
The British inventors are very creative in terms of making or inventing a technology. The vision sees through how do we actually can turn technology into improved clinical practice.
This is a piece of equipment that allows us to rehearse a surgical mission prior to doing it.
We performed the first patient procedure rehearsal carotid artery stenting last week.
The future is about improving outcome, minimising patient risk by simulation in a way that has been demonstrated in the airline industry.
Innovation isn't just about kit and drugs, it's about looking at the whole healthcare pathway. How do we tailor care around the needs of the patients? That's innovation.
I was really excited about the opportunity of coming to work in the paediatric short stay unit because it was a new way of developing patient care, a new streamlined approach for patients.
Birmingham Own Health provides telephone-based care to people with long-term conditions.
We build up a relationship with our members by making regular contact with them over the telephone. It's the first type within the UK of care management over the telephone.
Children, when they are here, and their families will not just be passive recipients of care. When they leave and go home, they go home as expert patients who are able much better to look after their own condition, know where to seek help, and therefore much less dependent on hospital care in the future.
Innovation isn't just for the doctors and nurses, innovation is for everyone who works in the healthcare system. There are pockets of excellence that we should all be very proud of. How do we really diffuse that innovation? How do we copy it from one area and transplant it into another area? We need the frontline staff, the 1.3 million people who work in the NHS, to have access to that evidence base. It's innovation in management. How do we stop doing things that there isn't the evidence base supporting them? Innovation should be very much part of our culture.
Be imaginative, be brave, be bold, be prepared to take a risk, and you'll get the rewards.